Welcome to the 2021 JHHS Shine Conference. My name is Madeleine Whalen. I'm the Evidence-Based Practice Program Coordinator with the Center for Nursing Inquiry, and I'm here with Alex. Hi, Alex.
Hi, everyone. My name is Alex. I'm also working with Maddie in the Center for Nursing Inquiry, and I'm an Inquiry Coordinator.
So thanks for joining me today, Alex. We are going to actually be reading an article today and going through the appraisal of that using the Johns Hopkins model and guidelines to see the level and the quality of that article. So we're going to get started. For anyone watching on the webinar, we have the article saved in the documents if you want to pull it up. We're going to be reading Improving Central Line Maintenance to Reduce Central Line Associated Bloodstream Infections, which came out recently in the Journal of Infection Control. And then we're going to be using the Appendix E, the research appraisal tool. And so I'm going to pull that up on the screen, show everyone how to find it. It's attached to this webinar as a document, but if you want to find it separately for when the next time you're appraising your article, I'm going to show you that as well. All right, so to get to the appraisal tool, I'm on the Center for Nursing Inquiry website. If I click these little 3 lines and go to Inquiry Toolkit, and scroll down, we're going to look at the research evidence appraisal tool. So that's Appendix E. And it's actually really exciting. We just updated these tools in the last few months. And so I think this is probably the first time we're doing a recording looking at the new tool. So everyone's going to be seeing it for the first time in addition to us. All right, so here is our tool. Alex, were you able to go through and get all your yeses and nos and figure out what level and quality we were?
I did, yes.
Okay. So this is the tool that we're going to use. You can fill it out online or you can print it out. But the first thing I always like to point out to people is that this is the most important question of all. And that's people tend to skip this box, but it's, does this evidence answer the EBP question? And if the answer is yes, we can continue. But if the answer is no, we don't have to do anything else. We don't have to read the article anymore. We don't have to delve into the quality, the level. We can just stop right there and probably note it to the team. But this is a really important question. You don't have to read anymore if the article doesn't answer your EBP question. So for the purposes of this, Alex, does the article answer our EBP question?
It does, yes.
Okay, great. Otherwise, this would be a very short recording. And these are now fillable tools. So if you actually click on the little box there, it will fill it in for you, which is kind of cool. All right, so the next thing is the article summary information. And this part is actually easier to come back to at the very end after you've read the whole article. Also, if it doesn't answer your question and you filled this in, then you kind of created some extra work. So you can come back to this part. So the first thing that we want to do is go down to our article appraisal workflow. But before we even got there, I kind of gave you guys a little hint in that we're using the research appraisal tool. But how do we know that this is a research article and not a quality improvement article? Because there can be a lot of similarities between those two types of projects.
So one of the big things is it creating new knowledge, or are we implementing an existing evidence-based practice? And in this article, they are implementing a central line maintenance kit. And they're using human factors engineering principles to create that kit. And they want to see if it actually works to affect CLABSI rates. So we don't know if it works or if it doesn't work. So it is new knowledge. That's one big thing.
Yeah, I think that's probably the most important thing, right? Is just the sort of the core definition between quality improvement and research. So research is new knowledge, and quality improvement is we already kind of know what works, but we need to make it work for us. There's also a couple hints that I usually try and look for in an article if I'm not quite sure, because they kind of throw around the language a little bit interchangeably. And so the 2 things I like to look for are, well, 3 things actually. The first thing is, did it go to the Institutional Review Board for an ethics review, and what did that review board deem the article? And so if you look on page 1225, it's the second page of the printed article. It says right in the middle of the right-hand column that this study was approved by the local institutional review board. So that's usually a big hint that it is a research study. And then the other thing that is informed consent. And so obviously we can't do research on people without telling them what the risks are and getting their approval to continue. And so they talk about the informed consent for the nurses a little bit farther down in that same column. And then finally, they talk about it a little bit, and actually it leads to a little bit of confusion, but whether or not people could opt out. And so if something is a quality improvement project, we know that this is best practice. Everyone on the unit has to do it. You don't get to decide, oh, I'm not going to do that CLABSI prevention kit because I don't I don't want to. Everyone has to do it because it's considered best practice. So whether or not people were able to decide if they wanted to participate. So those are some sort of, in addition to the core definitions of research and quality improvement, those are some kind of key things to help you search for in the article that will give you some hints. So now that we've decided that it is a research article, which we did before we pulled up the tool, we need to figure out if it's quantitative, qualitative, or mixed methods. So Alex, what do you think?
I think it is a quantitative study. They did a lot of observations and pulled some data from there. They did do some surveys, but that all resulted in quantitative data as well. They didn't really do interviews or open-ended questions.
Yeah, so any data that they did collect was numeric, right? That they were able to sort of quantify it on a scale versus just sort of asking people what they think and looking at the general description of people's input. So yeah, I totally agree. I think this is quantitative. So I'm going to tick that box. And then I need to, this is really important. This is a 10-page tool. If you fill out all the pages, you probably did something wrong. There is a lot of skip patterns. And so it's really important to pay attention to those so you know where to go next. So we ticked the quantitative type of article. And so we need to follow the directions which say go to section 1. And luckily that's just the next page. All right. So we are now on our quantitative appraisal section. And the first question is up here. And the question is this a report of a single research study? What do you think?
Yes.
Right.
It was held at one institution, and that's it.
Yeah, and they weren't like looking at multiple research studies and analyzing them and coming up with sort of a bigger conclusion, right? So it's just the one study that they did, which is not to say it wasn't a very, research is obviously a huge undertaking. So even though it's only one study, it's still very valuable. All right, so we said yes, so we're going to go down to the decision tree. And this is actually, I don't know if you remember from the previous tools where there was yes and no questions up here to figure out which of the 3 research levels it fell into, but we actually have changed that into a decision tree. Nurses love decision trees.
I like it.
So we hope this makes people a little bit easier for people. So I'm just going to ask you the yes or no questions. And you can tell me where you landed, if that sounds good.
Mm-hmm.
All right. So was there manipulation of an independent variable? Yes or no?
Yes. They implemented the CLABSI kit. And they compared it to pre-intervention.
Cool. Okay, so we're down here. And then the next question is, was there a control group?
Yes.
Yeah, so we're down here. They talk about that. I think they had compared to, yeah, it's on page 1226 in the left-hand column. It's right before data collection is to compare the influence of the central line maintenance kit. We use the previous status quo of central line maintenance as a control. So that they directly they use the word control, which is actually really helpful. So now we're down here. And then the final question is, were study participants randomly assigned to the intervention and control groups?
No.
Right. So we are now here. So it's a level 1 quasi-experimental study. So that's going to be important. We want to, I like to,
level
when
2.
I have, sorry?
Level 2?
Yeah, level 2. What did I say?
Level 1.
Oh, I'm sorry, level 2. Thank you. This is why it's good to do it in a team, because you can correct each other and catch each other's mistakes. So I like to actually, I think I usually circle it on here. It's a little harder to do, obviously, if it's on your paper, but you can highlight, or it's on the computer, but you can always highlight it or draw a circle around it. And then we're going to come back to this part because that's what we're going to record on that very first page. So we know we're at a level 2. And now we're going to kind of go through some yes or no questions to help us figure out the quality of the article, but the level combined with the quality gives us the strength. So we're actually already kind of halfway there because we have the level. All right. So now again, we're down into our yes or no questions. And the first question is, does the researcher identify what is known and not known about the problem? What do you think?
Yeah, I actually think they did a really good job in the background explaining the information that we know both about hospital-acquired infections, CLABSI rates, adherence to best practices. So I think they did a really good job of what we know and what we don't know.
Yeah, I totally agree. I thought that they really spelled that out well and kind of gave the reason that why you should keep reading and why they did the study in the first place. So yeah, I agree. I think that's a yes. And again, I can just click the little box there and it fills it in for me. And I think also I just wanted to mention that that's also where it's important to do, they probably do a version of a PICO question to be able to fill in that information about the population would be patients with central lines, Intervention could be something like a bundle, a checklist, a kit, and then comparing that with human factors engineering-based implementation, which we found out from their review that there isn't a ton of information on, right?
Mm-hmm.
And then I'm not sure what they looked at specifically, but there's all different types of outcomes that you could look at with that, like mortality rates, length of stay, cost, CLABSI rates, patient line days, all those types of things. So it sounds like they probably did, I don't know if they did a full-blown evidence-based practice project, but they definitely did a pretty thorough lit review before they started, which is really helpful.
Definitely.
All right, so then the next thing would be, does the researcher identify how the study will address any gaps in knowledge?
Yes, they did their lit review, and they found that there are a couple ways to help adherence to central line maintenance best practices. And they are doing a central line kit. And in that kit, they're also including a checklist.
Yeah, and I think it's really helpful when they really explicitly state what the gap is. And I think they do that on page 1225 in the left-hand column, right before it says non-adherence and checklist. It says, however, the approaches that have been applied to reduce CLABSI have yet to include improved equipment that incorporate human factors engineering principles. So I think this is always, I like to think about this when I'm thinking about if I'm going to write a paper, how helpful it is just to have it really spelled out. And so it's really easy to move through the checklist when they're really overt about what the gap might be. All right, so then we have 2 guesses. And then the next question is, was the purpose of the study clearly presented?
Yes.
Yes. Do you know where did they say that?
They, right before the method section, they talked exactly what they were going to do, and they listed their hypothesis that introducing this kit will improve adherence to best practices, improve patient safety, and reduce CLABSI rates by increasing standardization and reducing variability.
Yeah. And I think, and this kind of applies to all of the questions, but I just want to point out that no matter how well a study was done, if it's not reported well enough for us to be able to evaluate it and decide if it's something that we think is reliable and valid, then it doesn't really matter how well the original study was done. So the quality of the write-up is really helping us to be able to answer these questions as well. So I just wanted to mention that too.
Yeah, it was very well written up.
Yeah, I agree. Except I guess we're jumping ahead to the quality, but we still have our yes or no questions. All right, so the next question is, was the literature review current, most sources within the past 5 years, or a seminal study?
So I want to say no for this. It was written in 2017. And so if we're going 5 years back from the year that it was written, we're looking at, about 2012-ish. And most of their studies were about 10 years back. They did have a couple seminal studies in there, but it did range between 10 to 12 years back for most of the articles that they used.
Yeah, I noticed that too. How do you know if something's a seminal study?
I don't know, Maddie. Why don't you tell me?
Do you have like an easy way to explain what a seminal study is?
So a seminal study is a study that a lot of research was based off of, and was one of the big firsts.
Yeah, so it's like foundational to the area of research or the area of interest. And and sometimes it's a little hard to know if it's a seminal study. Maybe if you're really an expert in the field, you might know, oh, this is Smith and colleagues' seminal study on breastfeeding or something like that. But if it's something that you're not super familiar with, one of the things you can do is actually look up the article and see how many times it's been cited. And that if it's been cited thousands of times by people who are in that same field, it's usually a good indication it's a seminal study. You have an article from like 1990 and it's only been cited a couple times, it's probably just an outdated article and not a seminal study. So that actually takes a little bit more digging to make sure that you're not just having an older article. And it also brings to mind that you don't want to just write something off because it's older. It might actually be something that's foundational to that particular topic. So it's that takes a little bit more digging. But I would agree. I think that this answer is no. All right, next question. Was sample size sufficient based on study design and rationale?
So this one I actually had a bit of a trouble answering because they didn't really talk about the rationale or the sufficient size of their sample size. So they, got as many nurses and as many patients as possible to participate, but they didn't actually do any tests to see if it was a sufficient sample size.
Yeah, so there's two ways to figure out usually that whether or not you're going to have enough people participate to really be able to evaluate your results. And the first thing is to do a power analysis. So that basically decides how big of an effect size you want to see, how many people are involved, and then how many people you would need to get to be able to see that change. And then the other thing is, if you're not able to do that, is to look at previous studies that have looked at similar topics or used similar tools and said, well, they were able to figure out this happened with this amount of people, so we're going to aim for like a similar amount of people. But it sounds like they didn't really do that. They didn't discuss either of those things in this article.
Yeah.
And so there's not
it, but they didn't talk about it.
Yeah, exactly. And that's, again, like the quality reporting matters just as much as the actual doing of the study. And so it's hard to write it on here because it's a form, but I wrote in pencil maybe because we're not sure, right? And so that's kind of like a no or a maybe. I wonder if I can type maybe or a question mark. Oops. There, question mark. All right. And now we're going to talk a little bit about the control group. So we know that there is a control group, so these questions do apply to us. So the first question is, if there is a control group, were the characteristics and or demographics similar in both the control and intervention groups?
So they didn't really fully discuss this. They listed who was involved in the study and they listed the units that they used. So, you know, we can assume that it's the same units, the same nurses that were part of the pre-intervention and post-intervention. So I want to say yes.
Yeah, I don't, we have missed it, but I don't think that they, you know, normally they say, you know, we had this many people, this many were men, this many were women, this many were, had this much experience, but they didn't really do that. They didn't talk about the nurse or patient level demographics.
No, yeah, especially with the nurses, they gave a little more information on 1225. They talked about how many years of experience,
Oh, yeah.
They were student nurses, technicians, and like what units they worked on. But with adults, it was just adult patients on these units. We didn't get any information other than that.
Yeah, and I think that this is just for the intervention group, right? But they don't talk about it for they didn't really give any information for the control. So it's like almost impossible to compare. Yeah, so I would say, well, we don't know. And so it's kind of a no, probably. Or I'm not, I wouldn't say not applicable, but it's just not given to us. So that's again, another question mark. And then the next question is, if multiple settings were used, were they similar settings?
Yes, they used the same settings for pre and post, and it was the SICU, the MICU, and the telemetry unit. Yeah,
so I guess that's a way to, that's also like a good way to read the question. I think I was reading it as like if they were in multiple hospitals, were they the same? But I think that's actually probably a better way to think about it if the units that were involved were the same. So yeah, I think that's a good point or a good way to think about it. So we're gonna say yes. And then were all groups equally treated except for the intervention group?
Yeah.
Yeah, okay. Because they actually used the status quo from previous, so they didn't do anything for the control group, right?
Yeah.
Yeah. Okay, so that's all kind of like the methods. And we have a couple more that relate to how the study was done. So the next question is, are data collection methods clearly described?
I think so. Their data collection section was pretty thorough about how they observed everyone, what they were looking for. They talked a lot about how they got the inter-rater reliability between the observers. I think they did a really good job explaining that. Yeah, so that's all on page 1226. I personally really like it when they separate in the method section, the data collection, and then what they actually did. Mm-hmm. So they have a data collection section, and then they have a procedure section, which relates to how they actually intervened on the units. So I agree. I think that was well explained. So in that explanation, were the instruments reliable, which usually means a Cronbach alpha score of greater than 0.7. So they did not give a Cronbach alpha score to it. They did talk about inter-rater reliability also on 226 or 126, but they didn't actually give a score to it at all. Yeah, so I think that they did discuss it, and I think they said it was inter-rater reliability between the observers exceeding 95%. So Cronbach alpha isn't the only way to evaluate
instrument reliability, and they address it in a different way here. This is just one of the more common ways you see it. So I think I would say yes, they did talk about their interrelated reliability. And then the next question related to instruments is, was instrument validity discussed?
They did not discuss validity.
Yeah, I agree. So they talked about reliability, but not validity. Do you have a way to remember the difference between the two, or any tricks for remembering what's reliable and what's valid?
Do you have any tricks?
I do have. Thank you for asking. So just to remember, so something being reliable means that if our instrument's reliable, it means it's capturing the same value or similar to the same value every single time you use it. So if you're using a blood pressure cuff and they take my blood pressure 6 times, every single time it's about 120/80. So that blood pressure cuff is reliable in its measurement. Whereas validity is it actually capturing the correct information? So maybe I am actually missing my high blood pressure medicine and my actual blood pressure is 200/110, but the cuff is capturing 120/80 every single time. And so that means that cuff is reliable as it does it every time, but it's not valid because it's not collecting the correct information. And it took me a long time to keep those straight in my head. And what ended up helping me was to think about, so if you have a reliable friend, that friend is going to show up for you every time. They're going to pick you up at the airport. They're going to say they're going to do what they said they're going to do. And so you can count on the exact same thing from that reliable friend every single time. And it's the same thing with an instrument. You can count on the exact same thing from the instrument every single time because it's reliable. Whether or not that friend's doing what they should do is being valid is a different question, but you know that they're going to show up and be there and do what you expect. So that's sort of the way I like to think of it. Yeah. So, and I think that trips up people a little bit. So I think that's a good reminder. Mm-hmm. All right, we have a few more questions left. The next one is, if surveys or questionnaires were used, was the response rate greater than 25%?
So this one I also got tripped up on a bit because on, what page is it?
1228.
Yes. So they said that after every procedure, they had the nurses fill out the survey. So that makes me think that every nurse completed it, which we would have 100% response rate, but they didn't actually list a response rate.
Yeah, I had a unclear is what I wrote, because it does sound like they asked them to do it, but we don't actually know how often it happened. And it sounds like they were using that NASA TLX tool. Mm-hmm. So yeah, I think that's kind of another question mark, and we're not really sure. So I'm just going to leave that one blank for our own record keeping. All right, the next one is, were the results presented clearly?
I think they were. I think they laid it out pretty clearly for both CLABSI rates, adherence to the procedure, omission rates, task loads. I think they listed those pretty clearly. And they talked about statistical significance between pre and post intervention.
Yeah, I totally agree. I thought they did a really good job of presenting the information. So related to that is the next question. If tables were presented, was the narrative consistent with the table content?
Yes. So they listed a couple tables. They had a table talking about the human factors engineering principles and what they used to help create the kit. They talked about the sub-steps of like the interventions and compliance rates to each of them. And they didn't repeat anything that they were actually talking about in the results in their tables. So I think it was a good addition. If I wanted to know a little bit more, I can go and actually see the data. Yeah, I agree. I think they did a good job. And I think, like, if we're going to say no to that question, I think an example of that would be something like they didn't see any improvement, and that's documented in the table. And then in the narrative, they say, well, we did well with this intervention or something like that. So basically, we want the narrative to match the information that's in the tables and not be sort of a researcher interpretation of it in a different way. Mm-hmm. So that's kind of what that's getting at. All right. Were study limitations identified and addressed? Yes or no? Yes. It was a small limitation section, but participants weren't blinded, and the hospital itself had increased awareness to CLABSI rates. So they think that could have possibly influenced the reduction in CLABSI rates itself. But it was there.
Yeah, I agree. And this is going to come up when we transfer this information onto the next tool for the EBP process. And I always like to remind people that if study limitations weren't identified and addressed, that's a limitation in and of itself. Every single article should have the limitations addressed. And so if you say no to this question, that's kind of a big red flag that there is a limitation because they didn't even think to consider the limitations, which weakens the study in and of itself. All right, and then we're on the last question. Were conclusions based on results?
Yes. They found the reduction in CLABSI rates after implementing the new kit. They found meaningful changes in adherence to best practices. So I think it was all based off of the data.
Yeah, I totally agree. I also said yes for that. I thought they did a good job of sort of wrapping it up. And also, this is sort of an aside, but I also appreciated that they included the pictures and stuff of what they did, because I thought that was sort of helpful to think about what it would look like, in real life if you're thinking about doing something similar in your own unit.
Yeah, I agree.
So we have all of our yes or no questions answered, and then we have a couple that we don't know. And so the next thing would be to scroll down to the next page and to complete, this is the rating. So this is looking at the quality. Was it a high quality, good quality, or low quality? And there are some statements in here that if you can agree with most of them, it probably falls into that bucket. And so if we're looking at high quality, it's consistent, generalizable results with a sufficient sample size, adequate control, definitive conclusions, and consistent recommendations based on a comprehensive lit review that includes thorough reference to scientific evidence. So do we think that what do you think? Do we hit most of these?
I think we hit most of them in high quality. I did teeter between giving it A or a B, higher good quality, just because we do have a couple of those unknowns and a couple of things that the study didn't address. It doesn't necessarily mean that they didn't actually do it, and it wasn't a high quality study. It just wasn't talked about, so we couldn't fully assess it.
Yeah, I would agree. I think that I know it's always, people always want to fall between two of them, because I don't think that they did it perfectly, which would be high quality, but they did a really good job. There was a couple of these things that were, like you said, either not addressed or not done. And so I would agree. I think I would give it an A, I think. But it arguably, then that's what's great about doing this as a pair, is you can sort of talk about it and decide, well, I originally thought it was an A, but now that we talked about it more, I think it's a B, or vice versa. So what if you had to pick an A or a B, what would you pick?
I would probably do an A.
An A. Okay, yeah, I agree. And then the other thing is, I wanted to point out, because it doesn't really apply to this article, but this happens a lot, is if you actually get down here into the B or the C, so low quality articles, C quality articles, are actually considered not reliable enough to actually include in an evidence summary and synthesis. And so it basically means that this article is tossed out from the final review and recommendations. And so if you think that there's anything redeeming in the article that would bring it up enough to make it good quality, just keep in mind that if it's low enough quality, you're not going to include it at all, if that makes sense. So yeah, I'm going to agree. It's a high quality article. And then we're going to go back up and record the findings that help answer the EBP question on page 1. So we actually go back to the top. And this is where we would fill in all this extra information about the title, the authors, the population size. And then we don't have a question at the moment, but if we did, what part of the article helps us answer that EBP question? So I'm just going to put in 2A. And this is going to help us fill out subsequent tools in the EBP process. So if anyone has any thoughts or questions, or if you maybe think it's a B and not an A, or you think it's a different level, you can always join us on the discussion board for this talk. It's in Teams, we'll have a link to it, and we'd love to talk more about the article. This is always a group process, and we really like to hear people's insights. I've had so many times where I've had people point something out that I didn't notice, or say, hey, do you really think that this is true? And I've changed my mind a whole bunch of times. So even if you've done it a lot, there's always room for discussion and room for growth. If people want to reach out to us about this article or any other inquiry related questions, how can they reach us, Alex?
So there's a couple ways you can reach us. We have a new website on the internet. And then we also have our email address at nursinginquiry@jhmi.edu. You can send us an email. On our website, there's a contact form that you can fill out to get to us as well.
All right. Thank you so much. And all of our contact information will be on the next slide. Thank you so much for joining us.
Bye, everyone. Thank you.